Today, Cabinet confirmed decisions around the next stage of our Omicron plan. Around the world over the past few months, we have watched Omicron cases grow sharply and quickly. And while its trajectory in New Zealand has been slowed by strong booster numbers and our traffic light protections, we are now seeing the increases that ultimately we did expect. This is what we planned for. While cases may seem high now, we are still early in our Omicron outbreak, and cases we do expect to grow further. As such, more people will come into contact with COVID, either testing positive or becoming a close or household contact. We know that the vast majority of vaccinated and boosted people who get Omicron will have mild symptoms and will be able to get well safely at home. This means we can move our focus to a phase of greater self-management for most New Zealanders as we shift our systems towards those most likely to get seriously unwell, those who need more help, and to preserve our hospitals for those who need them. This does signal the start of a disruptive phase for many, and so our system also tilts towards minimising that disruption while protecting our most vulnerable. That is why today I can confirm that New Zealand will move to phase 2 of our Omicron plan from 11:59 p.m. tomorrow, Tuesday, the 15th of February. Just a brief outline of what happens at phase 2 and what it means for everyone. First, probably most important point, is the period for self-isolation reduces. The period of self-isolation for people who test positive for COVID-19 reduces from 14 days to 10 days. The period of self-isolation extends to their household contacts, so that means 10 days for them as well. We'll also enable that to be served concurrently. Now that removes the potential for people in the same household as a case to have to isolate for long periods of time unless they themselves test positive. This is a significant change and ensures household members only isolate for the period of their family members' 10 days of recovery, unless, of course, they contract COVID themselves. The period of self-isolation for close contacts reduces from 10 to 7 days. That applies across the board, including at MIQ, noting there may be a few days needed to operationalise this change. That means those who are eligible to travel into New Zealand from Australia on the 27th of February will only be required to isolate for 7 days. These changes that we're making are based on good supporting evidence. We've seen in the last few weeks, and we've been taking a look and a close analysis of what's happening with transmission of Omicron amongst our close contacts in our households. And we've seen that 90% of household contacts who are going to test positive do so in those first 10 days. So there's good grounds for the changes that we're choosing to make now. Here, though, I would encourage everyone to be developing a self-isolation plan. This includes identifying a buddy who can drop off essential items if needed. Anyone, of course, though, who experiences symptoms that get worse while they're isolating, particularly breathlessness, of course, we're still encouraging to call Healthline immediately. Secondly, at phase 2, the close contact exemption scheme begins. Overseas, we've seen that large-scale spread of Omicron disrupts supply chains and the ability of critical services to keep functioning at 100%. So to ensure we can keep our critical workforces going over the next few months, this scheme means asymptomatic vaccinated close contacts can keep going to work instead of isolating if they return a daily negative rapid antigen test. Businesses have already been getting themselves ready and doing their self-assessments against criteria to join the scheme, and we've had a total of 5,620 so far. In discussing those applications or those who have already joined the scheme, very much in areas where we've expected, including the likes of food production. Once a business is signed up to the scheme, an employee who is a close contact without symptoms will be able to go to a provider such as their local community vaccination clinic and secure a pack of 10 rapid antigen tests. In some cases, rapid antigen tests are being supplied directly to large-scale critical workforces. We've secured enough rapid antigen tests to deal with a widespread Omicron outbreak, with 7.2 million currently in the country and more arriving over the next week. While cases will still be diagnosed by the more familiar PCR tests, in the spirit of speeding up our work to identify our rule out of the virus, rats will start to be used more widely. including in the close contact exemption scheme and throughout high-risk settings, like for visitors to aged care facilities, as Dr. Verrill set out earlier today. Number 3, the other key thing people will notice at phase 2 is the greater use of digital and automation to speed up interactions. For example, a case at the start of self-isolation will fill out an online form for themselves and their household contacts that will help the health service work out whether or not support is needed. Now, we also asked to send in their likely contacts. Close contacts will receive a text notification and will then need to isolate for 7 days and have a test on day 5. There are alternatives in place for those who aren't able to connect digitally. We currently have nearly 5,000 active COVID cases, and 39 of those are in hospital, none in ICU. But of course, it follows that as cases increase, so too will hospital admissions. And so my most important message from this period carries through to the next. Get a booster if you haven't already. While 1.9 million New Zealanders have had their booster, 1.2 million who are due have not. It's very clear that the job is not done. Omicron is here and increasingly entering our homes. And as you firm up your household Omicron plan, make your booster the first thing you do to protect yourself and vulnerable people you know from getting the virus. The 3rd dose makes the difference. Knowing where the virus is remains critically important as we continue at phase 2 to minimise the spread and disruption to our workforce. So just like always, if you have COVID-19 symptoms or you've been in touch with someone who has tested positive, isolate immediately and get a test. Just like with previous variants of COVID, our goal is to still break those chains of transmission, and isolation remains one of our most important tools to do that. This is why our COVID-19 protection framework and our current setting of red and the protection it provides is so important at this moment in time as our cases grow. There is no change to the traffic lights. Schools, workplaces and everywhere else remain open and able to operate. And so we are embarking for the first time in the 2 years since the start of the outbreak into a period where New Zealanders will see more COVID in the community. It is a period of disruption and, I note, of risk. And it will be nothing like we've experienced to date. But our efforts with vaccination mean we have got to this place without the volume of serious illness and death that so many others have experienced. But it will be new, and so now is not the time to give up. The way to handle this period is the same as the previous times. Get tested, get vaccinated, and isolate if you're sick. And still, as always, be kind and respectful. I know there is COVID fatigue, but I also know that no one wants to let go of the freedoms we've gained from uniting and protecting one another. We need respectful discussion and tolerance as we navigate this next phase together.